Assalamu alaikum. I'm Dr. Sultan Badar Munir, consultant speech pathologist. I'm going to present a case of child 6 years old presented with history of foreign body stone finger ring inhalation for the last 4 days. He was taken to different hospitals near his village. At last, it was referred to the Children's Hospital Lahore. His baseline investigations were done on X-ray chest. Stone finger ring was seen in right main bronchus. Bronchoscopy was planned. Bronchoscope number 6 was used. As the foreign body was rounded, it was difficult with the forceps to grip it. At last it was caught with a big forceps, but it could not pass through the subglottis area. An accent was given, and after a number of attempts, the stone was removed. The child was comfortable after coming out of anesthesia. Thanks.